I might get
Sure is.
started with tonight. So thanks everyone so much for joining and supporting us through this series. It's so nice to have you all here. And thank you so much to everyone that's contributed messages and any myths that they want debunked throughout the week through our socials. It's awesome to see. Well, I mean, it's awesome to see so much sort of vibrancy in the community, but it's not so awesome to see some of the myths that have come through that we need to start to debunk. So just a little reminder of who we are and what we're doing for those that are new to Womb Talks. So Womb Talks is essentially a series of IG Lives that we're putting together. And this month we've got a whole month around cycle awareness. And we've had another couple of sessions every Monday. Tonight's session with all different topics. And tonight's session is all about debunking cycle myths. And we've got one more session next week, which is all around contraception, like I mentioned before. So these IG Lives are pretty casual. We'd love for you to get involved. Just pop any comments or any questions that you have throughout the session. And just a little bit about ANP as well, or natural pharmacy, for those of you who don't know. We basically exist to debunk the myths and educate all menstruators so they can be better informed on their cycles, and then also make better informed health decisions as well. And so we really have the mission of just opening up conversations, you know, debunking myths and starting to talk about our periods and our fifth vital sign, because they're such an important part of our lives. And we need to start somewhere to create the movement and to create that conversation. So for those of you who don't know, I'm Teresa, and this is Amanda Waaldyk, who's the founder of All Natural Pharmacy. And usually I sit here and I just drill Mans with a bunch of questions, and she has a bunch of diagrams. But what we thought we'd do tonight is format it a little bit differently. The whole subject is around debunking cycle myths. And so we put it out to everyone on our social channels during the week to ask for them to submit their myths and any kind of myths that you've had throughout your life, you know, that you've been conditioned with, anything that you've heard, whether it's from friends, family, medical professionals, anything that you've believed as well. And so we had an overwhelming response of all these myths that people have submitted. And I thought, geez, how are we going to do tonight, man? But what I've done is kind of categorize them. And I thought I might just start with like the categories of myths and some of the comments, and then perhaps you can kind of normalize it or tell us, is it a myth or is it not? And some of these might not be a myth. It might just be a little bit of like misinformation or misinterpretation or misunderstanding. So I thought I'd start with all the audience's myths and we'll unpack those. And then I do have a couple of questions to fire at you, but I promise I'll go gentle because I know that you're quite tired tonight. So I want to start with, I kind of categorized all the myths into themes. The very big one that came through was all around period pain, right? And there are myths that have been submitted, things like period pain is normal, being hunched over the floor in pain is normal when you have your period, tingling pains down your legs are fine when you have your period. And I guess, can we just normalize or have a bit of a conversation around what period pain looks like and should look like, if any?
Yeah, absolutely. Can you hear me?
Yeah, can hear you.
Okay, great.
Can see you too.
There's just been, well, I mean, throughout the ages, really, there has been so much taboo around the topic of periods. We haven't really even had the opportunity to talk about our normal bodily function, our monthly, you know, function that is our menstrual bleed, and even just the stigma around periods too. And what this has done is it's basically created a divide. It's created myths, and it's also created, you know, gender discrimination as well. So it is, you know, in 2021, it's amazing to see that we still have these cycle myths that exist in our modern times.
Totally.
It's crazy, right? We shouldn't have these myths, and women should actually know, and menstruators should know what a healthy period is and what their menstrual cycle is and what that entails. And so our menstrual cycle encompasses the 4 phases, which is our bleed, our follicular phase, ovulation, and our luteal phase. And for many, they don't really understand what a normal period looks like. And so let's break that down first. So every cycle length is different for women and menstruators. So we're told that a 28-day cycle is a normal cycle. And how this has come about is that the contraceptive pill was devised for contraceptive reasons. And so the pill essentially created what a menstrual cycle looks like and mimicked a menstrual cycle, which is 28 days. And so that's kind of where we've come with this myth of a cycle length for being 28 days, when in fact that all menstruators have different cycle lengths, and these can range from anywhere from 25 to 35 days. And so
man, I just have to stop for 1 minute because we've gone from period pain, which we'll go back to in a sec,
yeah,
but
we'll go
you've
back
just
to
debunked one myth, which I didn't even know was a myth, that a cycle is typically only 28 days. So that's not actually the case, is what you're saying.
No, that's not the case. That's right.
I mean, my mind's blown. Mind blown emoji, because we have for our entire existence, I'd say, been taught that the 28-day cycle is what a period is. And so are you saying that happens now? Is that individually? It's based on each individual in terms of the length of their cycle?
Absolutely. Yeah, so we all have
Right.
varying different lengths, and that's why it's really important to understand your body intimately and to also understand the signs and the clues that your body's sharing with you each day and every month. And so that's where we come into period pain. You know, we've all been told that period pain is normal, when in fact it's not. It's your body's way of communicating that you need to investigate a little further. So a dull, mild cramp is what we would consider to be normal. So you do sort of, women and menstruators will experience some form of a dull ache, potentially leading up to their period and then also during their menstrual bleed. And this is due to the prostaglandins. The prostaglandins line the endometrial lining, and they cause a little pulsation of the endometrial lining, and that causes the lining to shed. And so when we have that little pulsation, the lining sheds, we may experience a sense of movement, which is that dull cramping. But anything that's beyond that, okay, where we're keeled over in pain, is not normal. Where we're needing to take days off school, if we're experiencing a spectrum of stabbing pain, burning pain, rectum pain, you know, I want to share with you that that is completely not normal. And I think a big part of that has been the education through the medical system, is that, you know, menstrual cycles are really overlooked. They don't spend a lot of time understanding the different signs and symptoms that our menstrual cycle shares with us. And so this is where I think that there's a key piece of education missing. And so this is what Chinese medicine does, is we delve deep into gynecological health, and we will spend at least a minimum of half an hour questioning women and menstruators about the health of their cycle. And so...
Oh, I was just going to say, what you've touched on there, I think, is really key, that we have to highlight here to everyone, that pain should be dull, right? Because I think so many people, and there's already been a couple of comments here, but so many people go through their cycles and normalizing pain, normalizing excruciating pain, re-rolling around on the floor, normalizing heaps of back pain for, you know, not just the duration in the lead up to your period, but for a week or two as well. And we put up with that. So I think it's a real thing. We really need to highlight that the pain should be dull.
Yes, it should just be a mild little dull cramp. And
I think, what?
Well, it's also too, I think it's really hard because sometimes if we're seeing a male doctor as well, I mean, they don't necessarily always understand, you know, what it is like to be a female or a person with a womb that is experiencing period pain. And so I think it's really important to note that, yes, period pain that's rating on anywhere of 6 and above out of 10 is definitely worth investigating. And, you know, I think it's just been something in the Western world really where we've just normalized period pain. So let's debunk that one, which I think...
Yeah. like that's also a really great scale that I think is kind of a tangible thing that everyone can use as a bit of a barometer or a measure to say, hey, what's my pain like? Is it more than 6 out of 10? Maybe I should be doing something. And it kind of comes back to that also tracking your pain, tracking your cycles. And, you know, because every month's going to be different. You might have more pain one month, less pain another month, but maybe even using that scale as a bit of a guide, just as you're starting to track your period pain and your symptoms with your period is actually a really helpful, useful tool for people, I think.
Yeah, absolutely. We use the pain scale in clinic, and that way each month you can rate your pain and describe also too what that pain is like. So then when you do go to see your healthcare provider, you've got a diary and you've been able to track your symptoms, and then you can share your pain history as well, which I think is really important. Because,
yeah, and can we, so yeah, sorry, you go.
Yeah, you go. No, you go.
No, I was just going to say, so you just mentioned like what that pain is like. Can we talk about the different types of pains that people do get that they think is normal? So, I mean, we had a few people that submitted things like tingling down legs, you know, really sharp kind of stabbing pains. What kind of pains aren't normal? Like what does dull look like? Because I guess everyone's also got a different pain threshold, right?
That is true, yes. So a dull ache will just kind of feel like a little bit of a heavy sensation, sort of like it's your body's way of communicating that your period's coming. Sharp pain can indicate that there's stagnation within the womb, within your uterus. And normally that's accompanied with heavy bleeding, also clotty periods as well. So most of the time the pain will be accompanied with sort of a really heavy bleed, and also to clots. So keep your eyes out for clots in your bleed, and also to the volume that you're bleeding.
Okay, yeah, that makes sense. And so I also had a part of this pain kind of category that we just need to debunk. So someone did ask, or they've stated that ovulation pain is excruciating, and is that normal? So we're talking a little bit, we were talking about, you know, pre your period, but what about your ovulation
No,
stage?
ovulation pain that is sharp and intense is definitely not normal. So normally when we ovulate, we recruit a mature follicle. That mature follicle then releases an egg. So it's an energetic release. It's propelling that egg out of the follicles to then travel down your fallopian tubes. But if you're experiencing sharp pain, that is completely not normal and definitely worth investigating. And unfortunately, sometimes most people, when they are experiencing pain, they will go to their GP and they'll have a pelvic ultrasound, and often the pelvic ultrasound won't show anything. But behind the scenes, which you can't actually see until you've had laparoscopic surgery, there could be adenomyosis and endometriosis, and that's what you're experiencing your pain from. So it's
Right.
really, and that's kind of where we keep going around in this washing machine cycle, because you go to your GP, I'm experiencing pain. Okay, let's go for a pelvic ultrasound. It shows that there's nothing there. Oh no, you're okay, you're normal. Okay, carry on. And
Yeah.
that's where we've actually got to start to really change that narrative, and also to diagnostically.
Yeah, and I actually have a question around that, which I'll ask you after. I just want to make sure that we don't miss the audience's questions. And while we're kind of talking about ovulation, it's going back to before when you were talking about, or we were debunking that myth of the 28-day cycle. And someone asked, does that mean that ovulation isn't always on day 13 or day 14? So can we just answer that for the audience?
Yeah, absolutely. No, each month we ovulate at different times within our cycle. And this is my AMP. We really encourage you to start tracking your cycle, whether that's through an app or you're going to do that by hand with a BBT chart. Is that depending on the way and the time that it takes for our follicle to mature, is that sometimes we may ovulate a little later in our cycle. So we could be ovulating at day 16 or day 21 in a 28-day cycle. And so this is where diagnostically it's really good to do specific hormonal tests to test your FSH, your follicle stimulating hormone, and then your progesterone, because these are two key indicating hormones. Progesterone will determine that we've ovulated, and then the follicle stimulating hormone is what helps us to grow and recruit that dominant follicle in our cycle. So no, we
Awesome.
don't
And so,
always ovulate, and that's why we can potentially fall pregnant. Okay.
yes. Oh my God.
Um,
Another myth that someone wanted debunked was you can't get pregnant during your period. Oh,
well,
have
the
I got you
thing
still?
is, right? Yeah, you've got me. There is a potentiality, right, that some people you can actually fall pregnant during your period. It's rare, but within your cycle, if you grow that dominant follicle and then you release an egg, you have your period. Sometimes you can recruit another follicle that's kind of just lagging behind there. And when you come into your next cycle, is that follicle's already mature, and so it releases an egg super early. And so there are cases that you can fall pregnant during your period, because some women may also menstruate, and menstruators may menstruate for 10 days.
Mm.
It's a rarity, but
Yeah. Yeah, but it's good to know, right? It's great to know because we do think that, well, naturally I've got my period, maybe I can have unprotected sex, or I'm not at a chance of falling pregnant. And so it's really important to know that is something that could happen as well.
yeah,
Oh, I kind of
absolutely.
just want to go back to, because you started to touch on it and it was one of my questions for later, but I think it's fitting now. I want to go back to when you were talking and you've spoken about getting tests and, medical professionals and sort of, diagnosis and symptoms. And sometimes we're shut down with our symptoms. What would you say if we're in a situation where we feel like we're not quite happy with that result, or it hasn't been pushed enough medically? Like, what would you say would be the best approach if we want to challenge something that's related to our cycle or our condition? So, for example, if we go to a professional and say, hey, my period pain is excruciating, and then you go through these kinds of tests and they're like, it's just period pain, go on the pill, or just wear a heat pack. Like, how do we kind of overcome that, and how do we challenge that, particularly if it's coming from medical professionals?
I think it's really important that you need to find healthcare providers that will work, that will support you and work alongside you, that will really be your health advocate as well, that see you and also listen to you.
Yeah,
And
so
just to
like keep searching,
keep
like if you're sort
pursuing.
of running into that. Yeah, which is something that I personally had to explore myself, which is how I met
Yeah,
you, Amanda.
yeah,
Because you resist, you're told, for there's nothing wrong, there's nothing wrong, heavy periods are normal, go on the pill, blah 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 blah. And it's only 20 years in that I've realized that I've got endometriosis, right?
yeah.
So yeah, it's you're right. You do sort of need to keep on that hunt if you feel within you that something's not right and you understand more about your cycles and more about your symptoms. It's really important to kind of pursue that and find professionals that can help you and that do want to take you on that path to work out what's going on.
Absolutely. And to trust your intuition, you know your body the best. And if something doesn't feel right, well, then 100% of the time you're actually correct.
For sure.
It is your body's way of communicating with you. And I mean, it's only through 15 years of clinical experience of being able to
Mm,
really, fine tune those skills, that when someone comes into clinic, to be able to say, specifically looking at their menstrual history, looking at their menstrual pattern, their pain, to go, okay, I think potentially, yes, you have endometriosis. And then luckily enough, I've been able to now work with a wonderful group of Western medicine doctors as well, that listen to women and menstruators, hear your
mm.
stories, and then take you legitimately for what you're saying, which I think's super
Yeah.
important. Yeah.
It is. And you said something before around, find professionals that see you and hear you. And that's really important, isn't it?
Yeah. I mean, women and menstruators, there's a lot of us that have just been not heard. It's just like constantly
Totally.
shut down. No, it's just
Yeah.
basically ignoring, and then pacifying what you're saying.
Yeah. And normalizing what isn't actually
Yeah.
normal too.
And
Okay.
dismissing,
So a
dismissing.
real big,
Yep.
yeah, dismissing is a good, yeah, great word, man. So something that came up a lot, and I don't want to go too far into it because next week we're going to really unpack contraception. But there were a lot of myths that people submitted about contraception. So let's touch on it a little bit, and then please do come back next week for the contraception deep dive. But so there's been a couple of things around, you know, heavy clotting is okay, just go on the pill. The pill will cure acne. The pill will stop my endometriosis from coming back. A period on the pill will stop your pain. Do UDIDs make your pain worse? Can we just touch on contraception a little bit and some of those myths? So, you know, does contraception, or the pill specifically, cure acne? Does the pill stop your endo?
Well, as menstruators, we are hormonal beings. And so every month we're having different hormones throughout our cycle fluctuating. And so essentially we're having acne for a reason. And whether is that hormonal or is that gut health, is that to do with our microbiome? Well, it's, you know, it's definitely worth investigating. But the pill essentially shuts down our HPO axis, our brain to our ovaries, and it mimics its own cycle. And as we were talking about earlier, sort of that 28-day cycle. And so the pill is not actually a real bleed; it's a withdrawal bleed, and that's a withdrawal from the synthetic hormones that you've put into your body for that month. And so the pill is just masking. It essentially, because it shuts down that hypothalamus pituitary ovarian axis, it's shutting down your hormones, and that's why you generally will be experiencing acne tied in with gut health. And so it's just masking your underlying hormonal imbalance. And with the pill stopping pain, look, I think it definitely serves a place with endometriosis, particularly for really chronic cases, and for sometimes when women are wanting to sort of put their fertility on hold. So it can reduce your pain, but also too underneath, because you're having a synthetic estrogen, is that now that we know with endometriosis is that it has its own pathology. And so sometimes the cells of endometriosis, the endometriotic tissue, are quite estrogen, we want to say dominant. So, well, they have a dysregulation, right, a biosynthesis. So it means if we've got a synthetic estrogen, that is essentially can be causing the endometriosis to still grow behind the scenes, but you're actually not experiencing any of the symptoms that you would, because the pill has shut down your biology, right, basically.
And yes. So, I mean, you've just touched on, and we will go into contraception, like I said, next week, so let's not go too far, but you have just touched on something that I think we need to acknowledge around BandAid Solutions, which is obviously why All Natural Pharmacy exists. We want to get to our products get to the root cause of your actual problems. But how do we then create a movement to change the way that we're treated with misinformation and BandAid Solutions? Like, how do we get past this? Because we are so used to being told that the solution is a BandAid solution and that will help and it masks you. So how do we kind of move past that as a society? That's a pretty big question. Sorry, man. I said I was going to go easy.
I mean, I think we're shut down as well. And it's also too is that, you know, natural medicine has never really, it's always kind of been banished as well. So I think that now we're, at least in 2021, there's a little bit more movement towards integrative medicine, particularly over in the States, is, you know, things for treatment like cancer, IVF clinics, they support naturopaths, Chinese medicine. So I think we're starting to see a change, but I think that also comes down to education. Next year I'm going to do my master's, and I basically going to...
You're not doing enough. You don't have enough on your plate, so you should do your master's.
Because I've got a thing, right? And I want to change the education system in for GPs particularly, and health professionals. So then that way they've got a diagnostics that they can work through. So women get diagnosed a lot earlier than, you know, 7 years or 12 years for endometriosis. Absolutely. And I think that's really key. Yeah.
Well, Belle here has just said, like, one of the recent comments, and someone else had said a comment very similar, but it's 30 years on the pill for endo, and now Belle's paying for it. And, you know, Belle wishes that she had this info before. So it's such a great thing that you want to study your masters. Hats off to you. But we do need to start to create that movement, and it shouldn't take 7 years, for us to go through the motions and be diagnosed and work out what's going on and go on this, wild goose chase. So it's really important. And you're right, it starts also with kind of integrative solutions as well. And
I think that's what's going to be great for us is that's what we're about, is really to breaking down those barriers and providing that unbiased information so people can make informed choices and decisions around their health and go, okay, well, these are the side effects of going on the contraceptive pill. If I cycle on it for a little bit, come off, have some periods in between and then go back on it, at least that way they're going to be given the right information with evidence-based medicine as well, that they can then make informed choices.
Yeah, for sure.
Yeah. Go AMP.
And so go AMP, go Mans and her masters. It's great. And you've got a whole you've got a whole bunch of fan comments in the comments too. It's quite lovely. But so okay, I kind of just want to get a little bit lighter now and finish on a light note for tonight. Okay. There's been a lot of commentary around period shame, and things like, periods are shameful. You shouldn't be having sex while you've got your period. And then we got this one, which I think is really interesting because only recently have I learnt about period blood, but one which was period blood is dirty. And so I thought, let's actually finish on the note and talk about how not dirty period blood is and some of the uses perhaps that we're seeing with period blood now.
I mean, that is just disgusting that our normal bodily function of having our menstrual bleed each month is described as disgusting. And this is why we've often talked about these topics behind closed doors or just between our friends, is that because there has been so much shame, which there shouldn't be, is that we're liberated. We should be taboo. We should be celebrating our monthly bleed, that opportunity to be able to release and let go. Rather than shaming and hiding it. And I think this is really important for our younger generation now, is as, particularly as a mum, having that opportunity to normalize menstrual blood and my period, which is what we do. So Freddie's seen my blood, Winnie's seen my blood. We put it into the plants at home. So I think, exactly. As you do.
Yeah. Well, I only recently realised, because of working with AMP, that period blood can be used because of the stem cells that it has in it. It's actually really good nutrition for the plants, and it's got the same like makeup as what you buy in your fertilizer at Bunnings, right?
I know.
I mean, who would have thought?
Nitrogen, potassium, your essential minerals, iron.
Yeah.
I know.
In your period blood. And so, isn't it, it's incredible that people are still sort of referring to period blood as dirty, yet it's such a powerful thing that we can put into our plants and grow plants and fertilize, right? So, it's really important to just start to move our mind away from this kind of stigma and taboo of, oh, period blood dirty, oh, the kids shouldn't see my bleed. My sister tells me that the kids would follow her into the toilet with a tampon and she'd get really weird about it. But it's like, actually, no, you just need to normalize it, because there's nothing shameful, there's nothing bad or dirty about period blood.
No. That's it. It's each month we're cleansing, we're releasing each month. And so it's our normal bodily function of cleansing our internal environment, right? It's its own ecosystem. So it's helping to clear out vaginal secretions. It's shedding the endometrial lining. And, in Western medicine, they call this the debris, but in Chinese medicine, we call this it's our release, right? It's our fifth vital sign. And so it's sharing vital clues with us each and every month to our internal health, our overall health, gynecological, reproductive, and menstrual. So it's huge. Yeah. And it's powerful. It's life force, right? And it's there to help for creation in every sense.
Yeah.
creativity,
Yeah.
birthing, fertility,
Totally.
being
Yeah. All of
going
it.
through our rites of passage,
Yeah.
menopause. It's time that we really learn to
Existing.
honor and celebrate us,
It is.
right?
It
Yeah.
is. We've just had a comment actually, which is brilliant because Maddie, it resonates with me so much. So Maddie said that her mum said that her Italian family, they make sauce every year and she wasn't allowed to bottle the sauce when she was on her period because it would ruin the sauce. And there's myths so much like that. And, my mum was the same, Maddie. So I totally hear you. And we've had a couple of other myths just around things like you shouldn't swim when you have your period, you shouldn't exercise, you shouldn't have sex when you have your period. And all of these are kind of, I had one that somebody put in saying you shouldn't cook or visit sacred places when you have your period. And, all of these are examples of just like the conditioning and the society that we've grown up in, and comes back to that shame, right, that we've all had around our periods. So it's definitely
It's
time. And Maddie, tell your mum to make the sauce whether she's bleeding or not. you know?
so you got to change that now. That's right. It's the blood red sauce that makes
Yeah.
it gives it more vitality. But I think on that one too,
Yeah,
it is really
exactly.
it is important that we shouldn't actually over exercise when we are having our period, just because we're in that
Yeah.
releasing, and it's honoring that yin phase of coming back to that stillness as our body's losing energy and losing blood, is that we want to replenish. So always just going into that stillness and quietening down. And then also to swimming on your period, particularly even cold water, is that when our blood empties, is that our uterus becomes, it's called vacuous in Chinese medicine, it becomes empty. So it means that it's actually prone to more external invasion. So if you're out there swimming in cold Melbourne water or in the Arctic Ocean, is that cold
Yeah.
then comes in and can cause more tissue to contract, and the cold can actually lodge within your reproductive organs and vagina, which causes, there's an actual
Right.
pathology called a cold uterus, right? And you don't want a cold uterus because it
Right.
causes painful periods, cramping. And that's why sometimes women will go, I want heat on my womb, because there is actually internal cold.
So
So
isn't
there's
that brilliant to actually understand, like, sorry, you were breaking up a bit, maybe I
yeah.
just spoke over you, but isn't it brilliant to actually understand the reasoning behind some of these? So rather than just
Yes.
going, oh, you shouldn't swim on your period, because I think, oh, well, my mum told me I shouldn't swim on my period, but there's been no reason to not know. But now that you've explained it, you're like, great, I won't swim on my period, right? But it's just about
Totally.
actually understanding the reasoning behind some of these myths. Aren't actual myths. Some of there's truth behind some of these comments, right? So it's
Just
about
little
actually
bits of
understanding the core
information.
behind it. Little nuggets, hey?
Completely. Yeah, totally. They're
Yeah.
just missing that bit of info.
And so, and just we've touched on this a little bit before, and then we'll wrap up tonight. But if there's any other last minute questions, please pop them in the comments. But just around the kind of exercise part on your period, and then also with sex during your period. So with exercise, I mean, you've spoken about obviously going into a bit of a softer kind of still state, but I guess is movement and yoga and stuff like that okay when you have your
Yeah.
period? Is that encouraged?
Absolutely, is that because we're moving the energy through our womb, is that we're releasing, is that we want to be doing gentle movements such as yoga, Pilates, because that will
Yeah.
also, we like to be in that water element. So that helps also to ease pain and help promote a healthy blood flow as well.
Yeah.
And
And things
then,
like walking and yeah,
yeah,
go
walking.
for it.
Walking, yeah. Can't go past a good walk. Just intuitively listen to your body. If you want to move your body, move your body. If you just want to chill at home with, your favorite chocolate, do that too.
Yeah. I remember when I first came to see you, man, and you were like, what exercise are you doing? And I was like, high intensity, 5 days a week for the last year. And you're like, whoa, you've just got to stop for a second, listen to your body and chill. Because I was doing it whilst I was bleeding as well, and like really pushing myself. And you do push your body to your limits. And it is really important, like you just said, to actually listen to your intuition. And if one day, you need to stay in bed and you've got your period and you just need to lie and be and rest, you can, and it's okay.
Yes.
I think it's about,
Yeah,
accepting that it's okay to feel how you feel and do what your body needs, and listening to that intuition is really important.
totally. We're not men, right?
Yeah, we sure aren't.
And then I was going to say, so with sex, having sex during your period is actually really amazing. And we recommend it at AMP. And the reason being, too, if you are suffering from painful periods, is that semen contains prostaglandins. So prostaglandins can help to ease the pain, period pain. And it's also, too, it gets the happy hormones going. It gets your endorphins going. It gets your serotonin. So having sex during your period is actually a good thing. And it just depends,
That's
like,
awesome.
what you like.
Yeah. Yeah, totally.
Yeah.
But that's great to know because, again, that comes back to that, like, taboo of, like, oh, gosh, I'm bleeding. I better not have sex. Or, you know, some people want to stay away from their intimate partners when they're bleeding, right? And it's like, no, if we can normalize it, it is okay to have sex on your period if you feel like it. Power to you, you know?
Yeah, totally. That's it. Embrace it. Embrace your bleed.
Absolutely. It's so good. I feel like I've learned so much. Like I can have sex on my period and it's okay. But I feel like we've really deep dived into these myths and kind of unpacked some of the reasoning behind them tonight. So that's really, really important because they aren't just
I'm losing
necessarily
you,
myths.
babe.
There are some truths. Oh, you're losing me. Oh no. What about now?
You're really
Oh,
crackly.
oh no.
Yeah, go now.
Okay. Oh, I was just wrapping up and
That's
just saying
better.
that
Yeah.
okay, cool. I was just wrapping up and just saying that it's been really important to actually debunk some of these that aren't actual myths. Like there's some truths in what some of these things that people have submitted. And so I think it's important that we actually do understand the reasoning behind this, and it all comes down to education. So, oh, thanks, Steph, for letting me know that you can hear me. That's great. But yeah, I just wanted to say thanks so much, Mans, for coming and joining and debunking these myths. And thanks so much to everyone for joining as well. And please do join in for a real juicy one next week where we're going to be talking about all things contraception. It will be pretty big and mind-blowing. And Mans will eat her wheat picks and get a really good night's sleep the night before.
Totally, babe. Power up. And and then maybe have some little models as well. Bring in some figurines and
that's a great idea. Bring your figurines and your diagrams next week.
So we are going to be launching when? How long till we launch?
So we're going to be launching likely at the end of September or early October, which we're really excited about. So the website's almost there. And we've got a whole bunch of exciting stuff lined up. So yeah, please stay tuned because it's pretty exciting. And we're also going to need, you know, the support of the community because ultimately we are a startup and we're trying to create a movement. We've got, you know, the education piece, but we also have our tinctures and our products. And I guess we do need the support of all of you and our community. So please do keep spreading the word and letting everyone know about AMP and our vision. And thank you so much for supporting us. Mans has said that I've gone, but I reckon she has.
Oh, babe, I can't. Yeah, just totally did not hear you then. But thanks.
I think it could be your internet.
Thanks everyone for coming tonight. We really appreciate your support, and we look forward to seeing you next week for another AMP Room Talks as we debunk all contraception.
Awesome.
Okay,
thanks everyone.
CT.
See ya.
Thanks.
See you, man. Bye.